we have Aniruddha Banerjee with us today on Health Stories Speak. And I would request Aniruddha to speak about his experience with floaters and flashes in the eye. Over to you, Andy. Yeah.
Thank you, Manju. Thank you for this wonderful opportunity to share an experience that I don't mind admitting was a little bit rattling at the time it happened. But I'm happy to say that I'm completely recovered from it and therefore can speak freely about it. Thank you for your interest in it. And I know that you have a personal interest in this for various reasons. I will recount very briefly what happened to me and what advice I was given by the doctor and the treatment that I was given. My wife, who also named Manju, and I were visiting her aunt in Kolkata. This is in 2016, 8 years ago. July of 2016. And 2 or 3 days before we were supposed to fly back to the US, which is where I live, where we live in Boston, I had this weirdest experience, which I'd never expected nor encountered before in my life, which was sitting around the lunch table and talking and eating at the same time. All of a sudden, I felt my eyes go dark and then explode into a veritable, volcanic explosion of cobwebs in my eye. Now, at first, I couldn't make out what was going on because this came on without any warning. And it was so sudden that I was talking at the time, I remember, and I stopped in my tracks because of that. People asked me what was wrong, and I said, I really cannot describe it because I have no idea what was going on. And I also saw flashes of light coming out through the side of my eye. And this was very, very rattling because this is not an experience that you encounter every day. Now, I hadn't had the benefit of knowing that apparently this condition, the floaters and the flashes and so forth, tend to occur not routinely, but mostly among people over the age of 50.
Right.
And I was 60 by then, so I was perfectly in the risk group. But I had no prior idea that this sort of thing could happen. So it is always very disconcerting when it happens for the first time. But my first instinct was to try and seek medical opinion on this advice. Being in Kolkata, I was not sure which doctor I would go to or how quickly I could get attention, given that I was just 2 days away from flying back. So I decided to consult my cousin, who's a vascular surgeon, not an eye doctor by any means. But being a doctor, I thought he might have some insight into what I could do. And he suggested that I hang on somehow, get back to base, and then consult my ophthalmologist, who fortunately I did have one at that time. I've been going to him for many, many years. So that's what I did. I somehow endured the 2 days before the flight and then got on the plane, got back. It wasn't an easy travel. But the next thing I knew, I was sitting in my doctor's office, and he looked at me and he mentioned all the symptoms one by one, and I agreed that those were the things that were happening to me. He did a dilated eye exam, which is pretty much par for the course when something like this happens. And at the end of it, he concluded that there was an issue there, obviously. I was seeing floaters, which are basically dark spots that float around the eye. And I was also seeing these creepy, crawly, cobweb type things in the eye. And lots of them, not just one or two or occasional. And he said that you are very close to a retinal detachment. There is definitely a tear in the retina, but you're getting very close to the detachment of the retina. Now, I should remind everyone that the eye, again, do not take anything I say as an authoritative statement, because I'm not an eye doctor and I'm certainly not a medical person. But as best as I understand it, the eye has a vitreous humor, a gel-like substance on top of the eye, and that is attached to the retina, which is at the back of the eye, which controls, it's a tissue which controls the light that goes in and out of the eye. And then within the retina, there is the macula, which is the part that comes out with the central vision of the eye. So given that this is a layered structure, if anything happens on the outer layer,
Right.
to the best of my understanding, then it can affect the inner layer. Now, what happens in these situations is that the vitreous, which is the protective gel, it thins out with age.
Right.
And when it thins out, at some point, there is a danger of it separating from the retina. There are fibers which attach to the retina. And if it separates, and it does so violently enough, then there can be a tear in the retina. And if that goes on unchecked, then there can be a detachment of the retina, which means progressively leading towards vision loss. So the idea is to arrest it somehow, which means that the intervention should be, first of all, to replace the vitreous humor, which is that gel-like substance, which, by the way, thins out quite a lot between the ages of 20 and 50, and replace it, and then reattach the retina to the eye wall using some kind of a laser surgery or a method that is known as vitrectomy.
Right.
Now, this is only advised if there is a dangerous condition developing in the retina itself. If it is tearing up, or and you don't want irregular tearing, that's worse. And if there is even more, if there is a danger of detachment of the retina. So he must have, during his exam, he must have realized that I was well on my way to that state of affairs. And he said he was going to perform this vitrectomy on me within the next 48 hours, which is what I had to do. Fortunately, I only had it in one eye, not in both. And as a result, I did not have to have the surgery in both eyes. And generally, it's advised that if you have both eyes with this condition and the surgery is needed, that you don't do both of them at the same time. You do one, you wait a week, and you need to do the other. That didn't apply to me because it was only my right eye. We went back to his chambers. It was a outpatient, I suppose is the right word for it, outpatient type procedure. What I felt was that first of all, he numbed the eye with eye drops and little injections.
Right.
Then he put, I'll talk about this in a minute, he put a tracking dye in the eye, iodine dye. I'll talk about that in a minute. But for the procedure itself, he first took out the old vitreous humor.
Oh, okay.
He drained it out, and then he replaced it with new liquids, whatever that was. I don't remember the name of it, but it's supposed to do the job of the old vitreous humor.
Right.
And he replaced it with a new liquid. And then he took a laser gun, which looked like something you would use in building a home. It looked like a staple gun, really.
Right.
And literally, he brought it into the eye area and he stapled the retina back to the eye wall. And it felt weird. It wasn't painful because I was anesthetized. But every time he pulled the trigger, I felt a thud
Right.
in the eye. Not terribly painful, but at the same time, not the most comfortable experience you will have. And I think, if I remember correctly, he went around the retina, and it may have had about 10 or 12 such, the pulls of the trigger
Right.
before he said, okay, I think we are sufficiently done here. We don't need to do any more of this surgery. Just put an eye patch on. Don't drive yourself. Have someone else drive you. And you're going to experience some swelling for a few days. Keep an eye patch on all the time so as to not let bright light affect your eye, which has had the surgery. And take it easy. Essentially, don't lift weights.
Right.
Don't do anything strenuous. If you can, take some time off from work and let it heal. And which is precisely what happened.
So,
At the
so
end,
this was for, sorry, take it easy for about 2 weeks was the time, or how long did he say you had to?
I don't remember exactly. Like I said, it's been 8 years since then, but I know it was for at least a week.
Right.
I probably would not have taken 2 weeks off, given how things are here. You take 2 weeks off and you pay for it with your life after that.
Right.
So I probably just took a week off and on medical grounds. But I eased myself back into, in my line of work, as in most people these days, you're looking at a computer all the time, right?
Right.
That's your life. You sit at a desk and at a chair and you stare into a computer and you work on your keyboard. That requires your eyes to focus a lot more on small objects and small lettering than you would ordinarily.
Right.
And so that was the one thing I had to be cautious about, that I didn't cause a lot of eye strain by doing that for prolonged periods of time. Fortunately, I don't have any memory of any complications from the
Right.
healing process, during the healing process. Uh, and after about 2 or 3 weeks, or maybe after a month, I felt completely normal. It
And
wasn't.
it's been good since then.
Yes, I
Yeah.
won't say that the floaters have completely disappeared. I mean, every once in a while, I get a sensation that there are floaters around,
Right.
but nothing to compare, in terms of the scale,
Right.
nothing to compare with what went before.
And
So
flashes also gone completely.
completely gone. Yes. I do a lot of night driving. Lately, I've experienced a little difficulty driving at night, especially if it's snowing or raining, uh, only because I have also cataract in my eye.
Right.
That causes some issues with light entering the eye,
Right.
but not because of this condition. I think for the most part, the condition is over.
If you have this condition of the floaters and flashes, you need to go to the doctor immediately and have it checked.
Yes,
And the risk of tear or detachment has to be really kept in view, because the treatment will depend on that. Because
absolutely.
as you would remember, in my case, I've gone through the similar thing, but I did not have a tear or a detachment. So the
Yes.
doctor just left it at that, and they were just watching the situation. And they said it'll heal by itself, and we don't really need to do any treatment to the eye.
That is so true. Best as I understand it, there are 3 levels of severity for this condition. If it's mild, you'll see floaters. You may not see flashes of light, but you will see floaters. There's really no treatment for it except time.
Yes.
The second level of severity is when you start to see the flashes of light alongside the floaters, which become much more plentiful. And that's, I believe, a condition called posterior vitreous degeneration, PVD.
Yes.
That is kind of like a knife edge. Your doctor, depending on what he or she sees in your eye, is likely to say, really nothing to do here. Let me know if it gets worse, or might say it's time for some kind of intervention. The stage I was in was the most severe one, where a retinal tear had already happened, and there was a danger of a further detachment.
Right.
So I think he felt compelled to proceed right away.
Yeah.
It's a good thing that I didn't have to wait too long for the procedure.
Right. So thank you. Any last minute takeaways? Thank you.
Well, one can only be philosophical about this. When you get past the magical age of 60, a lot of good things happen. Grandkids arrive, and maybe you're contemplating retirement or you're already retired. Your life changes, but at the same time, all these health issues can also emerge
Right.
when you least expect them. And I think it's good to be aware that there can be these kinds of nasty surprises, but not to panic, because most of the time these are natural aging processes that bring these conditions on, and our doctors are pretty accustomed to treating patients, especially if you're over 60, in these matters. So just seek out medical counsel and treatment as best as you can.
Yeah. Thank you so much for talking to us, Aniruddha.
Oh, it's been such a pleasure, Manju. Thank you for your interest in it and giving me this opportunity.